Heart disease, often referred to as cardiovascular disease, is one of the leading causes of death in the United States and around the world. It encompasses a wide range of conditions affecting the heart and blood vessels, including coronary artery disease, heart attacks, heart failure, arrhythmias, and more. Understanding why heart disease occurs involves examining multiple interconnected factors, including genetics, lifestyle choices, medical conditions, environmental influences, and even psychological health. One of the primary contributors to heart disease is the accumulation of plaque in the arteries, known as atherosclerosis. This process occurs when fatty deposits, cholesterol, and other substances build up on the inner walls of the arteries, making them narrower and less flexible. Over time, the reduced blood flow can lead to chest pain, heart attacks, or even strokes. Diet plays a significant role in this process. Consuming a diet high in saturated fats, trans fats, and cholesterol increases the risk of plaque buildup. Frequent consumption of fast food, fried meals, processed meats, sugary beverages, and refined carbohydrates can lead to higher levels of bad cholesterol (LDL) while reducing good cholesterol (HDL), which normally helps remove LDL from the bloodstream. Additionally, excessive salt intake can contribute to high blood pressure, which strains the heart and accelerates artery damage. Another major factor in heart disease is high blood pressure, or hypertension. Hypertension forces the heart to work harder to pump blood, gradually thickening and stiffening the heart muscles and damaging blood vessels. Persistent high blood pressure is often linked to poor diet, lack of physical activity, obesity, excessive alcohol consumption, and stress. Obesity itself is a major risk factor. Carrying excess weight, especially around the abdomen, increases the likelihood of high blood pressure, diabetes, and high cholesterol, all of which are directly related to heart disease. Body fat, particularly visceral fat, can trigger inflammation in the body, which contributes to arterial damage. Physical inactivity compounds these risks. Regular exercise strengthens the heart muscle, improves blood flow, lowers blood pressure, reduces LDL cholesterol, and helps maintain a healthy weight. Sedentary lifestyles, which are common in modern society due to desk jobs, screen time, and reduced daily movement, significantly increase the risk of developing heart disease. Smoking is another critical factor. Tobacco smoke contains chemicals that damage blood vessels, reduce oxygen in the blood, raise blood pressure, and accelerate plaque formation. Even exposure to secondhand smoke can increase the risk of heart disease. Similarly, excessive alcohol consumption can weaken the heart muscle, cause high blood pressure, and increase the likelihood of arrhythmias. Genetics also plays a key role. Individuals with a family history of heart disease may inherit genes that predispose them to conditions like high cholesterol, high blood pressure, or diabetes. While genetics cannot be changed, awareness allows individuals to take preventive steps through lifestyle modifications. Diabetes, particularly type 2 diabetes, is strongly linked to heart disease. High blood sugar levels damage blood vessels and nerves that control the heart. People with diabetes often have other risk factors such as obesity, high blood pressure, and high cholesterol, creating a combination that greatly increases heart disease risk. Chronic stress and poor mental health are additional contributors. Long-term stress can lead to unhealthy behaviors like overeating, smoking, or excessive drinking. Physiologically, stress hormones like cortisol can increase blood pressure and trigger inflammation, both of which negatively affect the heart. Sleep is often overlooked, yet inadequate or poor quality sleep can increase the risk of obesity, diabetes, and hypertension. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, is especially harmful because it strains the cardiovascular system. Age is a natural factor as well. As people grow older, the heart and blood vessels naturally become less flexible, and the cumulative effects of lifestyle choices and medical conditions over time increase the risk of heart disease. Gender differences also exist. Men are generally at higher risk of heart disease at younger ages, whereas women's risk increases after menopause due to hormonal changes that affect blood vessels and cholesterol levels. Environmental factors, such as air pollution, can contribute as well. Fine particulate matter from vehicle emissions, industrial pollution, and other sources can inflame blood vessels, promote plaque formation, and increase the likelihood of heart attacks. Certain medications, medical treatments, or chronic conditions may also influence heart health. For example, some cancer treatments, autoimmune diseases, or prolonged use of corticosteroids can increase cardiovascular risk. Additionally, inflammatory conditions such as rheumatoid arthritis or lupus can accelerate artery damage. Nutrition beyond fat and salt is also important. Low intake of fruits, vegetables, whole grains, and fiber deprives the body of essential nutrients and antioxidants that protect blood vessels. Diets rich in antioxidants, omega-3 fatty acids from fish, nuts, seeds, and fiber have been shown to reduce inflammation, improve cholesterol profiles, and support heart health. Another key element is the balance of hormones and metabolic health. Conditions such as metabolic syndrome, characterized by a cluster of risk factors including high blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol levels, significantly increase the chance of developing heart disease. Even seemingly minor lifestyle habits, like prolonged sitting, chronic dehydration, or frequent stress-induced snacking, contribute over time to heart strain. Social determinants of health also matter. Access to healthcare, socioeconomic status, education level, and community resources influence one's ability to adopt healthy behaviors, access early screenings, and manage risk factors effectively. Smoking, obesity, poor diet, and stress are often more prevalent in communities with limited access to healthy foods, safe spaces for exercise, and healthcare services. Preventing heart disease involves addressing these multiple causes simultaneously. Maintaining a healthy diet low in saturated fats, trans fats, and added sugars while rich in fruits, vegetables, whole grains, lean protein, and healthy fats can reduce cholesterol levels and inflammation. Regular exercise, aiming for at least 150 minutes of moderate intensity activity per week, strengthens the cardiovascular system, improves circulation, and helps maintain a healthy weight. Avoiding smoking and limiting alcohol intake directly protect blood vessels in the heart. Managing stress through mindfulness, meditation, counseling, or hobbies can reduce the physiological impact of chronic stress on the heart. Regular medical checkups to monitor blood pressure, cholesterol, blood sugar, and weight help detect risk factors early, allowing timely interventions. Awareness of family history enables more proactive measures, including genetic counseling or early lifestyle adjustments. Even small lifestyle changes, like taking the stairs, walking during breaks, reducing processed food intake, and prioritizing sleep, can cumulatively reduce the risk of heart disease. Over time, heart disease is complex because it is rarely caused by a single factor. Rather, it is the result of multiple interacting influences, genetic predisposition, lifestyle choices, environmental exposures, metabolic conditions, stress, and more. Each factor contributes to the gradual strain on the heart and blood vessels, sometimes silently, until symptoms become apparent or a cardiovascular event occurs. Understanding these causes is crucial for both prevention and management. By addressing diet, exercise, stress, smoking, alcohol, medical conditions, and environmental exposures, individuals can significantly lower their risk. Public health initiatives in the United States also focus on education, healthier food accessibility, smoking cessation programs, and community-based exercise initiatives to help reduce the population-level burden of heart disease. In conclusion, heart disease is caused by a combination of modifiable and non-modifiable factors. Diet, lifestyle, physical activity, smoking, alcohol, stress, sleep, medical conditions, genetics, age, gender, and environment all play essential roles. Prevention and management require a comprehensive approach, including lifestyle changes, regular monitoring, and awareness of one's personal and family health history. Even though genetics and aging cannot be controlled, informed choices and proactive health measures can dramatically reduce the risk and improve heart health, leading to longer, healthier lives.